Okay, this is chapter 11 on the urinary system, module 5. The urinary system has 2 kidneys. Most people have 2 kidneys. You can have one. 2 ureters coming off of the kidneys to drain urine, a urinary bladder, and a urethra. That is the tube where the urine exits the body. The structure of the kidney, essentially what you need to know, kidney is sort of bean-shaped. You do not need to know these parts. The only part I would say comes up in medical terminology is glomerulus. And what that is part of the nephron where urine is formed. Also, maybe the renal pelvis is where the kidney attaches to the ureter. Okay. The function of the urinary system is to remove waste products, medicine, create urine, and balance fluids, which indirectly affects blood pressure, directly affects blood pressure and electrolyte balance. It does other things, but for our purposes, that's fine. Combining forms, this is the part where you need to know. Albumino sounds like albumin, which means protein. So if we said something was albuminoid, it is like similar or resembling protein. Azoto is referring to a nitrogenous compound. So some kind of compound that contains nitrogen, azoto. So azotemia is a blood condition of nitrogenous compounds. Bacterio is referring to bacteria. So bacteriuria, which urea we'll learn is a suffix for urine, is urine with bacteria in it. Now, cysto is, we learned that with gallbladder. Bladder of any kind is a cysto. So in the example of, in the GI chapter, polycysto was the gallbladder. In this chapter, we're talking about cysto as the urinary bladder. So a cystoscope is an instrument for visualizing the bladder or urinary bladder. And here's where glomerulus comes into play. Glomerulo is referring to the glomerulus. Glomerulopathy is referring to disease of the glomerulus. Okay, Kali, just like K is for potassium on the periodic table, Kali is potassium. Kaliuresis is urinating or condition of urinating potassium. Hyperkalemia is referring to a blood condition of excessive potassium. Ketono is referring to ketones, and ketonuria is a urinary condition containing urine containing ketones. Litho, we've had this one, is stone. So nephrolithotripsy is crushing of a kidney stone. Tripsy, crushing, nephro, kidney, litho, stone. So nephrolithotripsy is crushing of a kidney stone. Meato, if you remember from, I believe the special census chapter, meato is a meatus, which is any opening. So there could be an auditory meatus, nasal meatus. In this case, we're talking about the urinary meatus is the opening. So meatotomy, that's a mouthful, is an incision in the meatus. Meatostenosis is narrowing of the meatus or the urinary meatus. Nephro and reno both mean kidney. So nephropexy is a organ fixation of the kidney. Renal meaning pertaining to the kidney. Nocto is night. So nocturia refers to urinating at night. Oliguria means scanty. And you might be like, well, what does scanty mean? It means too little. So if we said somebody is scantily dressed, they're wearing too little clothing. In this case, I love this picture because oliguria means they didn't urinate enough like usually in a sample, or they're not making enough urine. So oliguria is scanty or too little urine. Pio is referring to pus. So pyuria is pus in the, pus in the urine. Be careful of the difference of pio and pyelo. Remember in the beginning when I was discussing anatomy with you, I said you might want to know the renal pelvis, or the point of attachment, the kidney to the ureter. So pyelo is referring to that area, the renal pelvis. And pyeloplasty would be surgical repair of the renal pelvis. Uro is referring to urine or urinary tract. So urolith, and look at all these different kinds, is a stone in the urinary tract. Uretero is referring to the ureters. So ureterectasis is expansion or dilation of the ureters. Urethro, so be careful, that sounds awfully similar. Uretero and urethro is referring to the urethra, the tube that is the opening to the body where urine comes out. So urethrostenosis is narrowing of the urethra. Okay, we've got practice slides for you. Okay, and abbreviations for this module. So BUN stands for blood urea nitrogen. I can type that. I think I can type that. And it is a kidney function test, but it technically stands for blood urea nitrogen. And it's a measure of how well the kidneys are functioning. So that's BUN. CNS is culture and sensitivity. So CNS is culture and sensitivity. And basically the culture part is to determine if there's a pathogen. So is there a microorganism causing harm? And the sensitivity lets us know which drugs, which antibiotic therapy would be effective against that pathogen. So culture and sensitivity. ESRD is awfully like GERD, reminds me of GERD, but it stands for end stage renal disease. So it's the end stage kidney disease. GU, similar to GI, but not quite. GU is referring to genitourinary, or the genitals and the urinary system, genitourinary. UTI is urinary tract infection, not to be confused with URI, or upper respiratory infection. A UA or U/A refers to urinalysis. It's a lab test. Okay, and here is a progress note. We can go through this since this chapter is so quick. A 76-year-old woman consulted with her primary care physician because of hematuria. So that's blood in the urine. And dysuria, that's painful, difficult, bad urination. She was referred to a urologist, which is a specialist in the study of the urinary tract. Laboratory tests of a UA, that's urinalysis, indicate +1 albumin and mild pyuria, that's pus in the urine, in addition to hematuria. A spiral CT, you had that one before, that's computed tomography scan, was obtained. Mild nephrolithiasis, that's an abnormal condition caused specifically by the kidneys stones, was observed, but no hydronephrosis. That is, OSIS is abnormal condition of water on the kidney. Finally, a cystoscopy, or process of visually examining the bladder, was performed and showed mild cystitis, or inflammation of the bladder. A UTI, or urinary tract infection, was diagnosed and responded to antibiotics, probably through a CNS. Urologists did not advise lithotripsy, which is crushing stones. So I hope you're getting better and more comfortable with progress notes. They're important. And as you progress with your knowledge of medical terminology, these are the kind of things you should be able to do. And that is chapter 7.